Patient experience is what receiving care feels like for our patients, carers and their families. A patient's experience starts from the first contact they have with us right through to the end of their treatment, which in some cases may be years long. Patient experience is a key element in measuring quality and care, ensuring that anyone who uses our services feels listened to and that their feedback and voice are truly heard. One of our patients on Broadfield Ward at Hayward Hospital recently spoke to us about her experience on the ward. Broadfield Ward is a neuro-rehabilitation ward. The patient had been on for a number of months.
So the staff on the ward are absolutely brilliant. No fault at all. They can't do enough for you. Nothing's too much trouble. Everybody wants you to feel at home as much as you possibly can. They've got so much time for yourself. They communicate brilliant with you. I know every day who I'm seeing and why. They've even done a little planner for me, which I think is really good. Yeah, I'm really involved with the physios, speech and language, OTs. Just everybody's just so good, so great. The communication with the staff and the patients have been really good. They all communicate with the doctors, nurses, whoever's involved in your care plan. Yeah, I like to know what's going on with me, why I'm doing it. You know, I just like as much communication as possible, and they've given me that. Yeah, so the activities on the ward are really good. One thing I did come up with is that it'd be nice if they came to the patients and asked them what we would like to do, which they took on board and they did. So yeah, we've got some different activities now, which is really good.
The patient talks about how staff on the ward pay attention to her specific needs, how clearly they communicate aspects of her care to her and involve her in decisions about her rehabilitation. She describes how ideas and suggestions from patients are listened to and acted upon by staff. This is the essence of a good patient experience. The staff working on Broadfield Ward hold regular patient forums where both patients and their families can have their voice heard, as well as being updated about any changes, activities or events on the ward.
It's an important way for us to gauge the mood on the ward, the tone on the ward, for us to see what the relationships are like, and you know, and it's always lovely to have a forum. If we do get compliments, that's always very nice. But also, if there is an issue, we can really use that time and space to dig into, well, what is it? Why is that bothering you? Oh, we can't do this, but we can do that. And I found it a really effective way of being able to explain, because I can explain it to the patient and their family at the same time. So it's really great for that. We're all trying to do our best. How do we measure that? You ask the people you're caring for. You've got to get their voice. You've got to get their experiences, their thoughts, their feelings. If we don't, how do we know what we're doing is effective or changing people? And, you know, could we do better? Possibly, probably, but you don't know unless you ask.
Patient stories can be positive, negative, or a combination of both. By listening and having one-to-one conversations, we are able to capture the everyday experiences of the people who use our services. If you have been a patient under the care of one of our teams or a relative of a patient, how did we do? Did we treat you with dignity and respect? Did we listen to you? Did the level of care you receive exceed your expectations? Or do you have some suggestions on how we can make things better? If you or someone you know would like to share your experience of using any service within our trust, you can contact our experience team, either by email or telephone. We are happy to answer any questions you have and can arrange a visit or appointment for you to share your patient experience with us. Thank you.